Welcome to the Caregivers Compass, where we guide you through the journey of aging, caregiving, and life's most important decisions. I'm Regina Webb. I'm an occupational therapy assistant, a senior care and transition strategist, and a licensed realtor, and the founder of Compass Senior Living Advisors.
And I'm Crystal Gadet, an occupational therapist, aging in place specialist, fall prevention specialist, and director of clinical quality and program development here to help you understand the care side of how you can make more confident, informed decisions. Together, we help families navigate senior care, housing options, and the emotional decisions that come with just caring for a loved one. So you don't have to do it alone. Let's get into today's topic, the hidden role that could change caregiving forever. So, what is that role, Regina?
That role is occupational therapy. And I
Yeah.
want to say happy Occupational Therapy Month, Crystal.
Yes, happy occupational therapy month to you
Yes.
too.
So today, in celebration of Occupational Therapy Month, we thought that we would share um, a little information about occupational therapy and how it can be impactful to a caregiver's life. Before we get started, though, I wanted to kind of introduce us in the occupational therapy space. So I
Mhm.
wanted to ask Crystal, how did you get into occupational therapy? And how did you learn about it and what it is?
Well, since I don't know if the people know that the Caregiver Compass is also a faith-based entity. So I will talk about that because that is what called me to be an occupational therapist. I truly believe that God wanted me to be an occupational therapist because I had no idea what an occupational therapist was as a child, as a teenager. Um, I learned about occupational therapy. I have the saying of, I know it's cliche, but I didn't choose occupational therapy. Occupational therapy chose me. I think God chose it for me.
Mm.
And reason being is that when I was in college, my freshman year, I thought I was an athlete. First of all, I was a D1 athlete, and I thought that I wanted to be a physical therapist. So I met this physical therapist who owned his own practice, and I just walked in one day and I was like, "Hey, um, I think I want to be a physical therapist, but I don't know anything about it. Can you teach me?" And he goes, "Oh, yeah, come on in Monday morning, dress professionally, and we'll get started." No interview, nothing. He just said, "Come on in and hang out." And as soon as I got there, he put me to work. As like when I walked in, he had patients who needed heat. And he's like, "Hey, that's a hydroculator. Go grab me some heat, grab me some towels, bring it over here. I'll show you what to do." And that was the Monday morning. On Tuesday, I found out that on Tuesdays and Thursdays, this woman came in scrubs, and I found out that he had an occupational therapist who would come into his practice twice a week to do occupational therapy.
Mhm.
And I asked him, I was like, "Hey, what's that? That looks kind of cool."
Mhm.
And he said, "Oh, that's occupational therapy. If you'd like, you can ask her if, you can go hang out with her on the days that she comes in so you can learn both." And I loved him for even just doing that for me because he could have said, "Hey, don't go bother that lady."
Mhm.
But he allowed me to go. So I went and I asked her, I was like, "Hey, he just told me what this is. And I just want to see if you are willing to let me hang out with you." And she's like, "Oh, yeah, of course. Come on in." And at the time, she was dealing with young adults and like teenagers, like athletes. So I would hang out with her, on the 2 days a week that she came in. And then eventually I said, I think I want to do that instead to
Mhm.
him, to my mentor. And he just laughed. He's like, "Oh, you're such a traitor, but okay, go ahead." And I finished up the summer with him. When I went back to school my sophomore year, I had a health advisor, and I told her, I was like, hey, I want to do this thing called occupational therapy. And she told me, she's like, you're the only person in this entire school that wants to do that.
Mhm.
I personally don't know much about it, but I have a friend who's an occupational therapist at John Hopkins, which was right down the street from my school. And she said, I'll give you her number. You can reach out to her and see if, you can just get some information from her. I reached out to her the very next day, and the lady was like, hey, you seem so enthusiastic about wanting to learn about occupational therapy. I'm not taking students right now, but because I'm doing research on this thing called aging in place,
Mhm.
and if you'd like to come along and see the research, I wouldn't mind you coming along, for like the first 6 weeks of the research project. And I'm like,
Mhm.
sure. And sure enough, I fell even deeper in love with occupational therapy because during like watching her do her research, I realized that, well, one, they found that, of course, hiring an occupational therapist helps people stay at home a little longer than
Mhm.
move to a facility, because now you're helping them with get more independent with their daily occupations.
Mhm.
And just through that, I just continuously fell in love with occupational therapy, just over and over and over as I grew to know more about it through my college career. And then I just went straight into OT school.
Mhm.
And I know this will sound a little, overconfident, but OT school was, yes, it was difficult, but it was also slightly easy for me. And I think it's because I was so in love with it.
Mhm.
Yes, there were times where I was crying because it is hard,
Mhm.
but I still felt that pull, and it still felt right. So even through the tears, I knew like, okay, I was meant to do this.
Mhm.
But yeah, so that's my extra long story on how I became an occupational therapist.
So much for a short episode.
I know. But people need to know because I love being an OT, okay?
Yes, yes.
So come on, tell me about you.
Okay,
How'd we
so
end up
my
here?
story, I was, um, I was in my 30s. So I was in my 30s, just desperate for a new career. And I went to my husband's best friend's wedding. And at the reception, you sit at tables. And we were at this assigned table, and some of the friends were there. And a young lady was talking, and she talked about how she was in school for occupational therapy. I had no idea what occupational therapy was.
Yeah.
So she gave me her brief description. It was very intriguing. And a little backstory, I have a brother who has Down syndrome. He is 9 years younger than me. And so I've always had the heart of a caregiver. I volunteered for Special Olympics. I did a lot of his school. When I was in high school, I volunteered for Circle of Friends, which was a where the normal kids volunteer to help with children with special needs, spend time with them, their buddy, and all of that. So I already had the heart for it.
Mhm.
Um, and so, just her description, it intrigued me instantly. Went home, I did a lot of research on it. I went to the US Department of Vital Labor and Statistics to really get an in depth understanding of it. And I'm like, this is me. A lot of the description, I felt like they were describing me.
Yeah.
And so at my age, I decided to, and I did the research. I said it would be quicker for me to become an assistant than go through school to be an OT because I was married. I had small children.
Mhm.
And so I took a pay cut and I found a job at a subacute pediatric hospital as a tech
Mhm.
because I actually applied for OTA and PTA school and I got accepted to both.
Mhm.
And so I needed to make it a decision of, okay, so which one,
Which one?
is a better fit for me. So
Mhm.
in getting the rehab tech job and working in that hospital's gym,
Mhm.
I realized that occupational therapy, which is more of a holistic platform,
Mhm.
it really tugged at my heart like it was calling me, like you
Yeah.
say. So I know that, all of my life experiences and then that experience, God prepared me for that moment of going into this field of occupational therapy. And so um, that's how I got here. I went through school, and because I started as a tech, when I did go through school, let me tell you, I was pregnant.
Yeah.
I was due the week of spring break, the second year. The
Yeah.
second year, I was due the week of spring break, and no, the first year, the
Mm.
week of spring break. So I got induced so that I could have the week that they gave me and have spring break.
Yeah.
And so my second year, newborn, nursing mom, up all night, I could not have done it without my husband. He was very
Mhm.
supportive. He really, really supported me and helped with the kids because we had two kids and
Yeah.
now I had the baby. And
Mhm.
so I spent many nights, but I got through it, but it was easy
Yeah.
because I worked in because I was a rehab tech. When you go through clinicals, when you go through the labs and all of that, I had been doing it for a year.
Yeah.
So I was almost like the co-teacher
Yeah.
because I did it every day. So everything, the timing was phenomenal. Only
Mhm.
God could do that. And so that's how I got into this field. And I know for a fact it is my calling,
Mhm.
and especially the population that I serve. I'm called to this. So
Yeah.
that's how I got here. So
Okay.
thank you all for allowing us to share our stories and how we got into occupational therapy. We're going to
Mhm.
get right into it, and we're going to do a little myth busting. This is a segment of our episode of our shows that we like to do to dispel
Mhm.
myths about things that may have learned about the various topics that we shared today. And let me say really quickly, if you like anything, if you learn anything, if you gather any great information from anything, please subscribe to our channel. Please hit the like. Please comment and let us know you're out there supporting us. We would greatly appreciate it.
Mhm.
And thank you for your time. Okay, so Mythbusters. Number one, I'm going to ask you, Crystal.
Okay.
First one, occupational therapy is just to help people get jobs. Is that a fact
Um,
or is that a myth?
You have no idea how many times I hear that. Way too many times that I walk into a room and people are like, I don't need a new job. Such a myth. Oh my goodness.
Occupation.
Oh man. It is a myth. The word occupation actually means daily life activities, not employment. So, OTs actually help you with your daily occupations like bathing, dressing, toileting, cooking, driving. It doesn't matter. But oh my goodness, it is a part of your daily life. So that is a myth. Occupational therapy does not help you get jobs. It is actually to help you with your daily activities of living. All right. Myth number two, OT and physical therapy are basically the same thing.
Well, that actually is a myth. Although they overlap, I like to describe occupational therapy as more of a holistic. You have speech, you have occupational therapy, and then you have physical therapy.
Mhm.
And I would like to describe occupational therapy as more of a holistic. All that, though, we have the capability of addressing things that speech may address or physical
Mhm.
therapy may address. A physical therapy mainly focuses on more things like getting stronger in your movement,
Yeah.
versus occupational therapy, we help with more of that function in real life.
Mhm.
So taking that, getting stronger, taking that movement and functioning in real life. So things like safely going to the bathroom, safely showering, safely
Mhm.
living independently in your home
Yep.
or wherever your place where you live.
Yes, absolutely.
Okay, so myth number three, occupational therapy is only for older adults.
Well, clearly, you're on the show called The Caregiver Compass. So that is definitely a myth because, yes, we do serve the older adult population or the geriatric population, but OTs actually work with all ages children, adults, teens, young adults, new moms, and of course, caregivers
Mhm.
because, we care for the actual patient, but caregivers also need some help or just some guidance on how to care for their loved one. We like to say if you can't care for yourself, then you can't care for another person. So if you injure yourself, you're no good to your family member that you're caring for. So,
Mhm.
absolutely a myth. We care, we actually serve all populations.
And I gave you a clue when I talked about me working at a subacute pediatric hospital
Mhm.
and how I learned the
Mhm.
difference between occupational therapy and physical therapy.
Absolutely. Myth number 4. So, if someone needs help, the caregiver should do it for themselves.
Do it for them.
Yes.
Do it for them. So this is a huge false. And I would even say that it could be very damaging.
Mhm.
A caregiver is someone that is losing their ability in areas in their lives. But if we just do it for them, we actually increase the possibility and expediting the losing of the ability. So we reduce their independence, we speed up their decline. So I would say
Mhm.
false, don't do it. I
Yeah.
know it requires a whole lot of patience to allow them to do things for themselves at time, but in executing those patients, you help them continue to do and be as independent as possible in their environment. So OTs teach caregivers us how to assist without taking over. I know that hand, just jump in there and let me just
Yeah.
hurry up and do it real quick.
Yeah.
Woo, that could be really rough,
Yeah.
but it hurts them more than it helps them. So we help you to assist them in those activities.
Yeah, absolutely.
So, myth number five, occupational therapy is just common sense.
While occupational therapy on the outside looking in may seem simple and like common sense, reality is if it were, caregivers wouldn't be injuring themselves, burning out, or even unintentionally like risking harm to their loved one.
Mhm.
Occupational therapy is more clinical problem solving. So you're breaking down tasks step by step, adapting environments, and just preventing long term decline. As far as so breaking down tasks step by step is what we call your analysis, just or your assessment. That's what you get initially whenever you go see an occupational therapist or occupational therapist comes to see you. So what do you think they're doing? They are breaking down every single step, and a caregiver doesn't necessarily have that eye to do that and problem solve through some of those things. So that's how, like you said, you just prevent injury to both the patient and the caregiver. So not as easy as it looks.
Right. Okay, so that was really good. That was our myth busters. So now we're going to go into a little bit of history of occupational therapy and where it came from. So when people hear occupational therapy, again, a lot of times they think rehab. But what if I told you that occupational therapy was originally rooted in mental health? And remember that May is when Mental Health Awareness Month.
Yeah.
So it might be the very support caregivers need and they didn't
Yeah.
know that they need it.
Yeah.
So we're going to
Absolutely.
go into just a little bit of the segment of occupational therapy and the history of occupational therapy.
Yeah. So I can take this. So just a little bit of history about occupational therapy. As Virginia said, it is rooted in mental health, which Mental Health Awareness Month is next month. I'm wearing my green already. um, so OT actually began in the early 1900s during the time when mental health treatment was actually evolving. It was it was influenced more so by moral treatment and movement, and it was focused on more humane and meaningful activity. So during World War I, actually, OT practitioners helped soldiers and veterans recover not just physically but also emotionally during that time. And then just over time, OT expanded into a more physical, rehabilitative um, sector, going into then things like pediatrics, geriatrics, and just the other populations that we talked about. And of course, eventually expanding into caregiving. But its mental health roots never left. And actually, um, some prerequisites for occupational therapy school are some mental health classes, some psychology classes. So you have to learn how to deal with the mental aspect as well as the physical aspect of occupational therapy.
So while many people think that occupational therapy as physical rehab, at its core, it's about helping people live meaningful, functional lives, mentally, emotionally, and physically. So it's like I mentioned earlier, it's very holistic.
Yeah.
So the next one is we're going to talk about transition and mental health awareness.
Yeah.
And that's exactly why OT matters so much as we move into Mental Health Awareness Month next month, because caregivers are one of the most overlooked groups when it comes to mental health and emotional health. We want to talk a little bit about how OT helps caregivers and the impact that they can have.
Yeah. So like one of the ways we can talk about is something we talk about on this channel a lot, which is preventing burnout. So some of those ways can be just teaching energy conservation techniques, setting realistic routines. So that can look like, do you have other family that can help to just kind of give you some respite, give you a break? What are you doing maybe around your home or after work, or if you just have just any kind of routine that can help you decompress and not burn out so easily? Just pulling at all of your resources, whatever resources you have. I know some caregivers feel like they have nothing and they have no resources. And if it's not family, just maybe talking to your friends and seeing, maybe most people who are going through something like this, especially caregiving, may know someone else who is going through the same thing, and they may have resources that they can give to you, or just reaching out to any healthcare provider and saying, hey, I'm going through this caregiving, and I just am at a loss. Do you guys have any resources that can help me? So just helping you stop running on empty or trying to pour from an empty cup. So OT doesn't just care for the patient, we definitely care for the caregiver as well.
Yes, and so another thing that caregivers can do is creating a sustainable routine. So things like structuring caregiver tasks, balancing caregivers with personal life, caregiving with personal life. One way that I suggest that is look into resources, look into companion care, maybe respite care, having someone come in, depending on the insurance may cover it. Um, and if insurance does not cover it, you may just have an agreement to pay somebody an hour, 2 hours, 3 hours, whatever you can afford, to have someone come in on a consistent basis where you can kind of step away and just have that moment to take care of you, take care of your responsibilities and things that you may have. That you need to really have your undivided attention and to focus on without having to worry about your caregiving responsibility. And then reducing chaos and decision fatigue. So maybe slowly work on organizing your home. A clean home is like having a clean mind.
Yeah.
So, as much as possible within the capacity of what you have going on in your home, organizing your home, decreasing the clutter, and what happens is it helps you just kind of think a little better, and gives you the opportunity to just take time to make
Mhm.
those decisions with as much clarity as possible.
Yeah, and also to add to that too, I'm not sure exactly what the programs are called, but there are programs out there that will actually pay you as a caregiver that's in
Yeah.
the home to
Hmm.
care for your loved one. Like I said, I'm not 100% certain what those programs are, but I do know there are programs out there that do help pay for that.
Yeah, I believe Medicare does, Medicaid. If you're a caregiver of a younger person, programs like Easter Seal,
Mhm.
that's another program that you can look into. So those are a few just kind of come at top of the mind right now.
Yeah. Okay. Um, Another thing is just the emotional and mental health support. So, finding coping strategies or talking to someone about coping strategies, stress management techniques, and then just addressing guilt and just the overwhelming feeling of caregiving and just some identity loss. I know for myself, I've seen caregivers who have brought their loved one to a facility, but then they keep coming back every day because they have no idea what their life was like prior to
Mm.
caring for this person. They have completely lost their sense of self because they were just so enthralled by their caregiving, just caring for this person. So just taking some time to really just get back to you and focusing on your emotional and mental health during and after your care for your loved one.
And I want to add to that, managing guilt. Being a caregiver, a lot of times individuals may feel like they're not uh, being doing good enough. They're not good
Mhm.
enough. They're not giving their best. The thing is, sometimes, and I think that it's because you're comparing yourself to when you were at your optimum self. So
Yeah.
when you're at your optimum self, giving your best, you feel like you're at the top of your game, right? But
Mhm.
when you're caregiving, you have all of this stress, you have all these burdens, your best self may be half of your optimum self. But the thing is, that's your best self at that moment.
Yeah.
So never feel guilty when you're giving your best in that moment. And it may be a lot less than when you were able to give at other moments. It's the best for that day. It's the best for that moment. It's the best for that time.
Absolutely.
And
Absolutely.
you really don't have the energy to even allow yourself to for the heaviness of guilt and all of that, because actually it decreases what you're feeling and what you're able to give out. Okay, so the next one we're going to talk about is environmental modifications. And I actually talked about this a little bit. Decluttering your home, organizing your home, not for the safety aspect, for the mental health aspect. It helps you to easily manage and get around. And then it reduces the physical and mental strain of a caregiver. So being able to just, even if it's slowly,
Mhm.
working on really getting that house organized, it will help you a lot as a caregiver.
Yeah. And training and confidence building. So that's also tying into the mental piece of this. Just training caregivers on how to do safe transfers. A lot of people lift just anything, not just a person, a box, anything with um their back. And you're not supposed to lift with your back, you lift with your legs. So just being able to have someone like an occupational therapist teach you how to do that correctly, because again, if you injure your back, now you can't really help your loved one. So even training on ADL training, so training how to properly bathe or dress someone or feed someone, reducing that fear and uncertainty around caregiving. So just using your resources, like we stated earlier, and just asking questions. There is no such thing as a dumb question, especially with something so serious. Ask a question, whether you think it may be dumb or not. Just ask it, because you never know how it can change your life and your loved one's life.
So the real talk moment from all of this is, which is caregiving and caregivers are expected to figure things out. But the truth of the matter is, caregiving is a skilled role. And in being a skilled role, occupational therapy is one of the few professions that are trained to support both, not only the patient or the client, the one receiving the care, but also the caregiver as well, the one that's giving the care. So, our call to action on today, which is encouraging caregivers to ask for OT services and normalize support.
Mhm. Yes, definitely. Making sure that you're normalizing support, because a lot of people also feel like, some people have a hero complex. Like, if I could just do this on my own, then I look like a hero. There is no reward for injuring yourself or your loved one. So just just normalize it, making sure you are reaching for every piece of support and resource that you have. And if you don't have, look for those things, or ask someone if they know of anyone, or if they have any resources that they can share with you for support. And support doesn't necessarily have to look like physical. It can also look like what we're talking about today, which is mental, making sure that you're just finding support in every direction that you can. Okay. So if you're caring for your loved one, you don't have to do it alone, and you shouldn't have to.
So, again, this is our episode tonight to enlighten you and to help you to understand occupational therapy, what it is, and how it can help you as a caregiver and as well as your loved one that you're caring for. So, our caregiver check in tonight is I want to ask you two questions. The first question is, and you can answer in the comment, the first question is, when was your last time you rested without guilt?
Mhm.
And the second question is, do you have a routine to support you?
Yeah. Do you?
So you can comment in the comments. I do hope that we shared value tonight, valuable information, something to help empower you as a caregiver. If you have any questions that you would like for us to answer, please write them in the comment. And again, please subscribe to our YouTube channel. Please share it with another person that may be looking for some support as a caregiver. And please like, share, and subscribe. Make sure I cover all of those bases as we grow this resource to help those that are out there that may feel like they're navigating caregiving alone.
Yes. Thanks for hanging out with us, guys.
Thank you.
Bye.